Essential Self-Care Podcast, a podcast for those of us who are, let's face it, too busy for self-care. In this podcast, you will hear real life stories from people who leaned into their self-care as they were navigating life's storms. You'll learn practical tips, tools, and strategies to incorporate self-care into your own busy life as well. You'll hear from expert guests sharing their expertise on specific tools and modalities of self-care to optimize your well-being in your life, career, and relationships. I'm your host, Dr. Sheetal Ajmani. I am a physician, best-selling author, and founder of Radiant Living Institute, where I guide high-achieving women to get unstuck and learn to live radiantly again through major life transitions. Quick disclaimer before we dive into the episode, please know that this podcast is for educational purposes only and is not medical advice. Always seek the advice of your own health practitioner or mental health provider for your specific situation. Now, let's get started. Welcome back to another episode of the Essential Self-Care Podcast. So I am really excited. Dr. Meghan Karol is here with me today. We actually just wrapped up recording an episode and we got to talking a little bit more and we were like, you know what? We need to hit that record button again and go ahead and just record another episode because we were diving into some really hot topics and the AC doesn't work in here in the studio today. And so when I say hot topics, like
literally and physically,
yes,
and all the things.
in all the things, hot topics. So as a reminder, Dr. Meghan Karol is a doctor of physical therapy, and she specializes in pelvic PT. She works with clients at Movement is Medicine PT in Norfolk and at the Juniper House in Chesapeake, Virginia. So she was previously on the show talking a little bit about what pelvic physical therapy is, why we need it, why it's important, issues that she helps with. And so pelvic PT just briefly addresses issues related to the structural support of the pelvic organs, bladder, bowel function, and sexual health. And last time, Dr. Karol explained that there are kind of four general areas, the four S's that you described: sphincter control, sexual health, stability, and support. Okay, so there's four areas of pelvic health that are kind of, there's a lot of different sort of conditions and symptoms that can arise within those four. But I figured let's talk about sex.
Let's talk about sex, baby.
So welcome back to the show, Dr. Karol. Thank you so much for being on the show, for sharing your expertise with us, and also for your willingness just to be like, yeah, let's just hop on. Let's hit record again. Let's just do it.
Yes, I know.
Let's just keep this conversation going.
We were kind of saying like all these things are taboo, but more and more, again, like social media, there's a lot of like videos and jokes of like, whoops, like peed on this, peed on that. Like, so that's not as taboo. Still a little bit because it's a little bit embarrassing to, just say I wet my pants.
And what she means by that also is like, we're not just talking about like generally peeing, but like, women, maybe specifically, she works with women's health, and that's kind of what we're talking about here on this show. But certainly, as we talked about in the last episode, pelvic health issues and pelvic PT can certainly be applicable to men and to children as well, but we're focusing on women's health. So, when you're laughing, maybe a little leakage, or when you're running or jumping on a trampoline with your kids and experiencing a bit of leakage. So that's what we were talking about.
Common, not normal. But yeah, that's what we were kind of talking about. But we were also kind of saying like, it's even harder to talk about sexual health. It's hard to say, that was painful. It's hard to say that to your partner. It's hard to say that to a medical provider. Maybe you're talking about it with your girlfriends, but they might not necessarily know. So that's a huge component of pelvic health therapy, is sexual wellness, and pain with sex is not normal unless that's how you want it, but otherwise like it is not normal, and yet very common. So we were sort of saying, some of the causes of pain, and there are many, But sometimes it can be very much a muscular issue. So, if you're watching us on YouTube or go log on to YouTube, I've got my pelvic model up. And basically, there is, muscles around the opening of the vaginal canal that should be able to stretch and elongate a little bit if penetration is to occur, if that's your choice of sexual health and your sexual expression. Now, those muscles can become very guarded or protective. Maybe there was something in your history that has kind of said that that's a negative, thing. I usually like to make the joke, like if there are sensors on you and I as we're sitting here and we saw a video of a car crash or there was a car crash, those muscles would engage. So sometimes, we have this anticipation of pain or anticipation of a negative experience, and those muscles guard reactively. For some people, that's from the very start. They've never been able to use a tampon. They can't do a gynecological exam. And then definitely penetrative intercourse, is sort of looped into that. For some people, they've been able to have penetrative intercourse or any penetration or insertion, no problem. And then all of a sudden something changed. Maybe they had a perineal tear after childbirth. And then that scar tissue isn't as mobile, and that's a little painful. Maybe there's dryness. We talked about previously through postpartum. Our estrogen really drops soon after childbirth if you're still breastfeeding, or through menopause, estrogen drops. Estrogen helps lubricate that area, lubricate those tissues. So if all of a sudden now there's this dryness issue, and then that area starts to associate, hey, this hurts, don't do this. And then those muscles can kind of start to react sort of involuntarily, protectively. So that's called vaginismus, when you have that muscle spasming to sort of bar or, not have penetration. It feels like a tightness. It feels like you're hitting a wall, or maybe just penetration cannot occur. So that's a big piece of it. There can also be pain with deeper penetration. So those deeper muscle layers, or if any of the pelvic organs are a little bit more sensitive, pissed off, and then all of a sudden they're kind of experiencing this jarring sensation. Sometimes that can cause, again, a reactive spasming. Or with climax, that is muscle contraction, spasming. So if your muscles are already painful, already tight and tense, and then they're getting even more tight, for some women, they have pain with climax. Maybe it's after climax. Maybe it's for the whole rest of the day and into the next day, like a lower abdominal cramping, or, just doesn't feel good. So there's a lot of different things that can happen that can cause pain with intercourse. And again, there's a lot of different things, with thorough assessment to kind of figure out what exactly is causing that pain. That's what we have to first answer to then be able to have a good treatment plan to alleviate that.
Yeah, absolutely. Thank you so much for going over that.
Yeah.
I think it's really important. I think, like you said, and like we started off, sometimes it can feel it's still maybe a little stigmatized or taboo to kind of talk about these sort of things, but it's important. And I've mentioned in some previous episodes, especially this year, that one of my intentions with the podcast, as well as just with the work I do in general, is to start having conversations and creating safe spaces to have conversations about things that we don't talk a lot about, but that we need to. And what's really interesting as well is that is diving me into topics that maybe I don't know that much about either. And having some vulnerability myself as well in different areas. And so I'm glad that we're talking about this, and that hopefully this opens up the conversation for women who are listening as well. A couple of points that I want to just kind of draw out from something that you shared, and something that we were talking before we started this recording as well. You had mentioned that you have had a number of clients who have never been able to have pain-free, penetrative sex, right? And that they almost just kind of consider that as sort of their normal, And so I think just knowing that there is a therapeutic process out there that you can go through that can hopefully find some improvement and or complete resolution of those symptoms, right? I think is just really, really important. Because sometimes we kind of move along our life, whether it's this situation or other things, thinking that, okay, well, this is just normal for me. And this might just be how it is for everyone. Like, I don't know. Right. And so knowing that, one, through this conversation, that it isn't, and that there are options out there for you to seek some help, and that there's no shame in that.
Nope,
there's no reason to be embarrassed about that. Like, that's what.
But we were saying how difficult, even for us, we were saying how difficult of a conversation it can be, and again, how vulnerable that can be. So to have the courage to go to someone and say, I can't do this, or it hurts, or, any of those things, it does take a big courageous step to do that.
Absolutely. And that's a great point. Absolutely a great point. Yeah, I mean, we were talking about that, even as professionals, right?
Yes.
Like you and me, it's taken us some time to talk about these things a bit more openly, even though we are in the health professions, so it's very interesting. And then also what you mentioned about, and again, this was right before we started the recording. I'm telling you, we should have just kept it going, but I'll catch you guys up to speed here. But one of those things was that, someone will come to you with a specific symptom, and maybe that is, hey, it's painful when I have sex. And then you will follow up with that with many questions. So I think, know that that's like, know to expect that, and that it's for good reason. And it's for many of the reasons that you just described, Megan, is that there's so many different, you really need to kind of figure out, where that underlying cause is. There's different layers that it could, that could be affected. It could be affected depending on, kind of the timing, either at the beginning of penetration, towards end, during climax, right? And all of that information actually matters in terms of you being able to develop your treatment and management plan. Am I correct?
Absolutely.
Yeah.
And even kind of some of the questions that we didn't even talk about is, again, what position does it happen in? Does it change in different positions? Do you use lubricant? You should be using lubricant, all of these different things. And again, if you were sitting with me in my office, or if you're watching us on YouTube, I'm like, I'm not thinking about anything that you and your partner are doing. Like my pelvic model, the bones, the muscles, the ligaments, that's what's living in my head. So again, I can appreciate, sometimes that these are hard questions to answer, because of course, we think about like what us and our partners are doing. But when you're with a medical professional or medical provider, or even a counselor or anyone like that, again, they're thinking about it very differently and approaching it very differently. So sometimes it is kind of nice to be like, oh, but wait, like they don't care, what I'm doing. Or if they do care what you're doing, find a new provider that is more open with you and you feel comfortable talking about these things. Because there again, if you know what's going on, and if you can point to, hey, this now has a solution instead of just this arbitrary, I don't know, it's not good, it hurts.
Quick shout out to today's sponsor, Reclaim Your Radiance, Radiant Living Institute's signature coaching program designed to help you reclaim your worth, renew your energy, and restore your happiness in your life, career, and relationships. This 6-module curriculum has already helped countless women rediscover themselves through life's storms. From setting difficult boundaries within toxic relationships, to finding their inner strength and power while navigating divorce and co-parenting, to aligning their career and business with their authentic self, and to learning how to live for themselves again after their kids have left the nest. This program has been a guiding force for women to live unapologetically and shine brightly within their lives once again, or often, even for the first time ever. Experience the results for yourself. Head over to radiantlivinginstitute.com/reclaim-your-radiance to learn more and get started. Yeah, absolutely. And then the other point that I wanted to make is that there's so many different layers to this, and one thing I always say is like everything is connected, right?
So connected.
like the physical body, mental, emotional. We were talking earlier, relational, right? Like all of this is connected. And so you mentioned that, right? Like it could be, like obviously the muscles tightening up. That could be a part of it. That could be related to something emotional, right? It could be related to that anticipation that comes up from a very mental, emotional place, right? From your memory, from the emotions that brings, right? Of, this, remembering it in a way of, this was a painful experience before. Okay, I'm anticipating this is going to be painful again, right? And then if that happens over and over and over again, or if you've had that happen over and over again, then like not only does your mind, your emotions learn, your body learns,
Yes.
the muscles learn.
Yes.
Like,
and then
this
it
is
becomes
how to react.
subconscious. Like you could be, 100%, mentally, psychologically, like, this is what I want. Then again, the body might react not according to that. An example I give a lot of times to people is like, we were sitting here and I had like a fuzz or a hair on my arm, like no big deal. I would just like pick it off, brush it off. It's just an annoyance, a bother. But if we were sitting here and I just saw a tarantula over on the corner and then I got a fuzz on my hair, I'm going to react very differently. And then again, if my body just kind of always is anticipating something, again, you can kind of mentally be like, no, this is what I want. It's not in my head. And again, you always have to be careful of like phrasing it, like, but it's in your body, it's in your nervous system. It is a learned anticipation. So having ways, therapeutic ways to work through that, so then that kind of mind-body connection settles itself.
Yeah, absolutely. And it's a learned anticipation that then, produces this response in your body, which is meant to protect you.
Yes.
You like your body, your nervous system, the muscles, like they all think that they are, not they all think, but essentially they're functioning in a way to protect you. And so I think also understanding that can be helpful in terms of then, like you mentioned some like mind body techniques. And I know in the previous episode you had mentioned when we were talking about kind of what the therapeutic process can look like, and in the previous episode, we were talking about kind of a wide range of symptoms, not solely related to sexual health, but kind of all the other realms that you work with as well. And I know, as we just said, I'm asking a lot of big questions. And so, of course, and we mentioned this, nothing takes the place of individualized guidance, tailored to your specific situation. And we just talked about how there can be such a wide range of etiologies that could be leading to symptoms, the types of symptoms that we're talking about today. And so what would be kind of, we talked a little bit about kind of an initial assessment. What would be some, and I know it will vary depending on the actual root cause, but what are some techniques that you would use to help someone who is having painful intercourse?
Yeah. So almost everyone starts with, how do you even take a deep breath? Unfortunately, most of us don't even know how to diaphragm breathe. We don't know how to, get into that deeper breathing state. And a lot of times I'll explain it to people, hey, we're sort of in this like sympathetic fight or flight, state, or we're in our parasympathetic rest and digest state. And as we're, we're in the woods and a bear jumps out at us, we should be able to rev up. We should be able to fight it off or run back. But once we're back into the safety of our cave, we should be able to light our fire, cook our meal, eat it, go to sleep. But these days, our bears don't go away from us. They're always there. They're always in our head. And whatever is happening in your mind is happening in your body. So deep breathing, diaphragm breathing has a lot of different benefits. But one of the big ones is helping your body shift into that calm, rest and digest parasympathetic state, which then is going to help you relax those muscles a little bit more. And again, it's not as simple as that, but that's one big component. The other piece of why like diaphragmatic breathing and pelvic floor are so related is they kind of mimic each other. So as the diaphragm comes down with an inhale, the belly will expand, the pelvic floor will also expand, and then everything kind of recoils. So I always say, like, imagine filling a balloon with air in your belly and your pelvis and just that passive elongation. So that's another way to kind of help maybe muscles that are just constantly living in a tense state open and relax and, kind of decrease their guarding a little bit. So that's a big piece. And then we'll incorporate that into maybe stretches like a child's pose, a happy baby, if you're familiar with different yoga positions, anything to kind of open up through the back and the hips, which also help open up through the pelvis as well. And then we use that breath to, again, elongate those muscles and let them relax a little bit, because every muscle should have good strength, good length, and then good coordination to be able to go through those different phases. So those pieces, we might be doing I'll say massage therapy. So just like you can have a tight point, a trigger point, like in your neck or your shoulders. Again, that can happen in those pelvic floor muscles, whether through those first more superficial layers or those deeper layers. And so again, just addressing those trigger points, those tender points, that muscle tension through massage with a therapist. There's also ways to do that at home, which I would teach someone. It's called a pelvic wand, to be able to access those muscles a little bit more easily at home. That could be a piece of it. There's dilators, so ways to be able to kind of allow and practice and allow your body to calm as it's experiencing a circumferential stretch. So they come in different sizes, and starting with smaller, whatever you can tolerate, gradually building up from there. But it's not just to like insert it, make it fit. Again, you have to sort of retrain your body and your reaction and your nervous system and the actual muscle tolerance for that stretch. So it's way more than just put it in and make it work. It's a whole, process through that. So lots of different components, to addressing that pain. But those are sort of the big picture ones.
Yeah. Thanks so much for, going over that. And I think also, what you described, I think also want to emphasize again the importance of seeking the support of a therapist to help guide you through that, because like you were just saying with the dilators, like it's not like, okay, just make it work, it's like, no, there's an actual process, for this, right? And so seeking a specialist to help guide you through that process to what you need for your specific situation, I think is so important. And also, going back to what we shared earlier, is just knowing that if this is something that you are experiencing, that there are resources out there available. And that's one of the main reasons that we wanted to come back on and hit the record button here. And then I also wanted to touch on another piece that we had talked a little bit about before we had hit the record button, just because I think that's important too. Obviously, we're, focusing on your specialty of pelvic PT. And we've also talked about how so many different things are related, like mental, emotional, the nervous system, the fight or flight response, relational, right? And so knowing that this is one component of that, and that there may be other aspects to be addressed too. You were sharing with me earlier that sometimes you will talk to your clients about, like, okay, I'm focusing on the structure, the muscles, and, you may want to speak to someone about, your relationship and what are maybe some relational factors that could be related, or, just different things like that. So just knowing that it may be a bit of a multifaceted approach.
Absolutely. Right? Absolutely. Yeah. It could be, again, kind of that multidisciplinary team, depending on what's going on. So again, seeking assistance with a, sex counselor, or even just a, general counselor that feels comfortable talking about, these topics. Sometimes working more closely with your gynecologist, like, are there certain medications that are help? We didn't even touch on like vulvodynia, when the tissue itself, that mucosal tissue, is heightened sensitivity. So sometimes that needs to be, addressed and managed, maybe with medication or, different aspects of it, to then allow also those muscles to sort of, allow and calm down. So yeah, it's usually can be a multifaceted approach.
Great. Thank you so much. Now, as we're wrapping up, I'd love to give you an opportunity. Is there anything about this topic that maybe we didn't cover yet that you would love our listeners to know as we're starting to wrap up?
Oh, I don't even know, because there is so much. It's really, honestly, if anything isn't feeling right to you, again, we've been focusing on the sexual, component of it and the sexual health. But if anything kind of between your belly button and your thighs, like, isn't all fine and dandy, like, honestly, that area you almost shouldn't have to think about, right? It's sort of designed to just be in the background. So if there's anything that is interrupting kind of those, I'll say, quote unquote, normal functions, don't hesitate, seek out, get that information, and be like, what is going on with this? Instead of just being like, is this my new normal? Is this how it is? All these things kind of happen behind closed doors, and you don't know, can't compare it to someone else. So if anything isn't feeling right to you in your own body, go seek out and ask someone. And if you don't like the answer, ask again, get opinions and different approaches.
I love that. That is the perfect way to wrap up this episode. Absolutely. Like, if anything feels off to you, know that there are likely resources. Seek support. I love that. Thank you so much. Now, Dr. Karol is doing wonderful work. She does see clients and work with clients in person here in Hampton Roads. She's also active on social media, providing a lot of educational content. And so where can people find you?
So I'm at Movementist Medicine. So you can find us online at movementistmedicinept.com. And then on Instagram, you can follow me at mkarol, DPT. And Carol is spelled with a K. So it's MKAROL DPT.
Wonderful. And I will include all of that in the show notes. Thanks again for being here.
Thank you.
Thanks for tuning in to this episode of the Essential Self-Care Podcast. If you like what you heard, be sure to subscribe, leave a positive review, and share this episode with someone you know. And remember, your free guide, 6 simple yet powerful steps to create your radiant life, is waiting for you at radiantlivinginstitute.com. Download it today.